Hello, my name is Mariam, and I will be discussing the ethical issues of treatment of suicidal patients, specifically regarding case study 3. Claire is a 30-year-old woman who lives at home with her parents and sisters. Her father is quite verbally abusive, while her mum has more of a caring nature, however, has high expectations. Claire feels as though she cannot open up to anyone, as her closest sister tends to be quite opinionated and her friends tend to be selfish. This causes her to feel alone and depressed, and she has learned to hide her feelings from the rest of her world. Claire has attempted a suicide in the past, particularly on the train tracks, and the only thing that had stopped her from doing so was the thought of emotionally disturbing the train driver or those who had found her body. Her sister is aware that Claire is going through a difficult time, however, she does not know the extent of it nor her suicide attempt. Claire is contemplating a suicidal plan again, and she doesn't want her body to be found, and she does not want a painful death as well. She plans to do so soon, possibly tonight. My initial thoughts regarding Claire is that she is extremely depressed and emotionally disturbed. She needs to seek efficient help as soon as possible, as this is an urgent matter, possibly even being taken to a mental hospital and medicated. Furthermore, she does not have a supportive network, as she feels as though she cannot open up to anyone around her. The DSM-5 and the APS Codes of Ethics are sources of information for psychologists that outline codes and guidelines of practice regarding what is ethical and what is unethical. In Claire's case, the client's safety must be considered in dealing with Claire. Specifically, the psychologist needs to respond to the client's need immediately through intervention and appropriately referring them to the practitioners such as psychiatrists. This is outlined in the DSM-5 as stated in section 4.1. Another important aspect to consider is the safety of others in the situation. The psychologist must consider those that might be affected by the proposed suicide and the impact it may have on family and friends, therefore, the need for immediate intervention. Confidentiality and competence in self care must be considered by the psychologist. It may be ethically responsible for the psychologist to contact the primary caregiver of Claire so that they may look after her. Furthermore, if the psychologist is unable to help the client or feels as though this ability is not within their expertise, they must refer the client to another professional immediately. This is to ensure that further harm is not caused. The psychologist must also ensure that their mental state is not affected. Self care is a critical ethical component of working effectively with suicidal people, as outlined in the DSM and the APS. In my first interaction with Claire, I decided to refer her to a more skilled and competent psychologist so that she could benefit the most from her therapy session. This was as per the ethical principles of the APSS, which states that propriety is important. That is, psychologists ensure that they are competent to deliver the psychological services that they provide. She responded to this quite upset and quite angry, even using foul language in her speech. This was unexpected. However, given her suicidal thoughts and deep depression, it is understandable that she reacted in such a way. I then decided to continue seeing her, as I did not want to ruin the rare trust that I had with Claire. Also, given her suicidal state, refusing to see her may lead to a suicidal incident that very night. She responded well to this and opened up some more to me. Given her desperate state and intense suicidal thoughts, I decided to call the CAT team to help Claire. According to the APA, confidentiality may be broken in cases where revealing important information may cause harm to the person or others. And that's why I decided to respond to the CAT team. Her response was positive and was a little unexpected. I was worried that Claire would lash out and be extremely annoyed at my decision to do so. She appears to want the help. 90% of psychologists reported seeing a client with suicidal thoughts. In particular, CBT is an effective method for reducing suicidal thoughts, as explored by Linham and colleagues in 2006. From the baseline to the 18-month period, follow-up, 24.1% of the CBT group attempted suicide, as opposed to 41.6% in the usual care group. Therefore, as you can see, they were significantly lower for the CBT therapy group when comparing to the usual care group at 6 months. However, one limitation of the study is that participants could have possibly used medication during treatment or could have used other forms of treatment alongside the CBT. However, the study successfully implemented regular follow-ups at various periods. Also, medication is useful in reducing depressive thoughts and suicidal behavior. Rufus and colleagues in 2013 analyzed suicidal risk in schizophrenic patients regarding medication. Results indicated that lower suicidal thoughts were associated with antipsychotic medication. Therefore, in the future, a possible suggestion would be to analyze CBT and to analyze medication and to see whether the two work well hand in hand. The main take home message with my interaction with Claire is that dealing with patients with suicidal thoughts can be difficult and quite overwhelming, as they are often quite sensitive. Therefore, it is important that all psychologists dealing with such patients learn to respond in the most effective and immediate manner. Furthermore, it is also important to be fully aware of the ethical principles and the legal requirements so that options can be thought about appropriately and also so that the ethical principles and the legal requirements do not clash. When confronted with ethical issues, it is helpful to implement an ethical decision-making model. In my case, I refer to the Krusha and Keefe Spiegel 2008 A stages. So the first stage referring to is the issue is an ethical dilemma. So in my case, yes, it was. In particular, there were issues of privacy versus wanting to warn loved ones, and the competence versus client trust and immediacy to respond. Second, consult relevant codes, guidelines, and laws. In my case, I refer to the APSS and the DSM-5, specifically relating to client safety, confidentiality, and competence of the psychologist. Stage 3 is to identify factors and traps which could influence a decision. My personal values, such as religion or my cultural background, were not an issue in dealing with my client. However, my dealing with my client and my desire to help her improve comes from the belief of valuing life. 4 was to consult with an experienced colleague for a second opinion. Though I continued seeing Claire, it is important that I seek a second opinion from my supervisor with Claire's permission. 5 is to evaluate the rights, vulnerabilities, and responsibilities of all parties involved. It is important that I consider the rights of the family involved to be informed of her suicidal state and how they may be affected, and Claire's rights to confidentiality. So there was a bit of a battle between those two. 6 is to generate a range of possible actions, to consider continuing seeing Claire to the best of my ability, and to suggest to Claire how her family may help monitor her suicidal attempts. If feeling overwhelmed, consider referring her to a more competent psychologist with Claire's permission. However, if this is not the case due to her immediacy to respond, another possible action would be to call the CAT team. It's also important to determine the probable consequences of each action and to weigh this up. A is to decide and act accordingly. I have decided to keep seeing Claire and have called the CAT team to further assist her in her suicidal attempts. In essence, ethical decision making can be a complex procedure, especially relating to suicidal patients such as Claire. Early signs of depression, thoughts, and suicidal ideas should be depicted so that immediate intervention can take place. Psychologists need to be well aware of effective and immediate intervention strategies regarding suicidal patients that are ethically acceptable. This includes CBT or such as like medication, so that they are well equipped in dealing with patients who need urgent care. This is often because psychologists in these situations are put under immense stress and therefore they might feel overwhelmed. So having a plan can help. Psychologists may be trained better regarding suicidal intervention and to always have a plan ready for action. Psychologists need to be aware of the ethical principles regarding confidentiality, competence, and immediacy to respond, and whether such principles are parallel with the law. In addition, if they are unaware of how to act, it may be helpful to refer to an ethical decision-making model.